In 2020, over 270,000 women and men are expected to be diagnosed with invasive breast cancer in the United States, and 42,000 are expected to die. In the state of Georgia, over 8,000 women and men are estimated to be diagnosed with breast cancer, and 1,200 may die. In addition, African American women have a 41% higher mortality rate compared to all other races. It is estimated that there are more than 3.8 million women and men living in the United States with a history of breast cancer. The good news is the survival rate is 98% if breast cancer is found early. The purpose of this presentation is to present the facts on breast cancer, help women understand their risk factors, and emphasize the importance of early detection. In the United States, 1 in 8 women will develop breast cancer, and although breast cancer is the most common form of cancer diagnosed in women, breast cancer is the second leading cause of cancer death in women, with lung cancer being more attributable to cancer deaths in women. And breast cancer is 98% survivable when detected early. To understand what breast cancer is, we have to understand what is cancer. Cancer is just not one disease, it is a group of diseases. All forms of cancer cause cells in the body to change and grow out of control. Most types of cancer cells form a lump or a mass called a tumor. The tumor can invade and destroy healthy tissue. Cells from the tumor can break away and travel to other parts of the body. There, they can continue to grow. The spreading process is called metastasis. When cancer spreads, it is still named after the part of the body where it started. For example, if breast cancer spreads to the lungs, it is still breast cancer, not lung cancer. If the spread is not controlled, it can lead to death. Inside the breast. What is breast cancer? Most kinds of cancer are named after the part of the body where the cancer first starts. Breast cancer begins in the breast tissue. The breast itself is made up of the nipple. The dark area surrounding the nipple is the areola, and also the breast includes the lobules, ducts, fatty, connective, and lymphatic tissue. Inside the breast are glands that produce and release milk after a woman has a baby. The glands that make the milk are called lobules, and the tubes that connect them to the nipple are called ducts. Lymph is a clear fluid that contains immune cells and tissue waste products. The fluid is carried in lymph vessels that lead to small, pea-sized collection of tissue called lymph nodes. Most lymphatic vessels of the breast lead to lymph nodes under the arms. They are called axillary nodes. A risk factor is anything that increases a person's chance of getting a disease. These are the primary risk factors for breast cancer. Gender. Being a woman is the main risk factor for developing breast cancer. Breast cancer can affect men, however, it accounts for only 1%. Age. Risk increases with age. Age is the single most important risk. Family history of breast cancer. Risk is higher among women with a family history. Relatives can be from either the mother or father's side. The risk is higher if more than one first-degree relative had breast cancer or if the relative developed breast cancer at an early age. Menstrual periods. Starting menstruation at an early age before 12 or beginning menopause after 50 has a slightly higher risk. Women that have no children or had her first child after the age of 30 have a higher risk. Hormone replacement therapy. Most studies suggest that using hormone replacement therapy 5 years or more after menopause may slightly increase the risk of breast cancer. Doctors generally prescribe 2 hormones, estrogen and progesterone. Estrogen is prescribed to prevent the menopausal symptoms and osteoporosis. It, however, can increase the risk of developing cancer of the uterus. The progesterone helps prevent cancer of the uterus. If the woman no longer has her uterus, then only estrogen is prescribed. Women need to discuss this with their doctor to determine their risk of developing breast cancer and the options of taking or not taking hormone replacement therapy. Remember, if a person has 2 or 3 of these risk factors, it still does not mean that she will develop breast cancer. There are ways that you can reduce your risk of getting breast cancer. Scientific evidence suggests that about one-third of the cancer deaths that occur in the United States each year are due to nutrition factors. Many dietary factors can affect cancer risk. Types of food, food preparation methods, portion sizes, food variety, and overall caloric balance. Choose most of the food you eat from plant sources. Eat 5 or more servings of fruits and vegetables each day. Eat other foods from plant sources such as bread, cereals, grain products, rice, pasta, or beans several times a day. Limit your intake of high-fat foods, particularly from animal sources. Choose food low in fat. Limit consumption of meats, especially high-fat meats. High-fat diets have been associated with an increase in the risk of cancers of the colon and rectum, prostate, and endometrium. Be physically active and achieve and maintain a healthy weight. Physical activity can help protect against some cancers, either by balancing caloric intake with energy expenditure or by other mechanisms. Limit consumption of alcoholic beverages. Alcoholic beverages, along with cigarette smoking and use of snuff and chewing tobacco, causes of cancer of the oral cavity, esophagus, and larynx. Signs and symptoms of the breast to pay attention to. Swelling of all or part of the breast, even if no lump is felt. Skin dimpling, sometimes looking like an orange peel. Breast or nipple pain. Nipple retraction, turning inward of the nipple. Nipple or breast skin that is red, dry, flaking, or thickened. Nipple discharge, other than breast milk. Swollen lymph nodes. Sometimes a breast cancer can spread to lymph nodes under the arm or around the collarbone and cause a lump or swelling there even before the original tumor in the breast is large enough to be felt. Early breast cancer usually does not cause pain. In fact, when breast cancer first develops, there may be no symptoms at all. But as the cancer grows, it can cause changes that a woman should watch for. A woman should see her healthcare provider about symptoms like these. Most often they are not cancer, but it's important to check with the healthcare provider so that any problems can be diagnosed and treated as early as possible. Following a good breast health plan improves the chances that breast cancer can be diagnosed at an early stage and treated successfully. A good breast health plan consists of 1. Becoming familiar with any abnormal appearances or changes in the breast, 2. Getting a regular clinical breast exam, and 3. Getting a regular screening mammogram. Always check the breast for any abnormal appearances regularly. Women ages 20 to 39 should have a clinical breast exam of the breast every 3 years. Women 40 years of age and older should have a clinical breast exam of the breast every year. A clinical breast exam is a physical exam done by a healthcare provider. Normally, during an annual physical, a clinical breast exam should be performed by a healthcare provider who is well trained in the technique. This healthcare provider may be a physician assistant, or a nurse practitioner. Women who are 40 years of age and older should have a mammogram every year. It may also be sooner if there is a personal history of breast cancer or a family history of breast cancer. A mammogram requires that you dress above the waist. A wrap will be provided by the facility for you to wear. A technologist will be present to position your breast for the mammogram. Most technologists are women. You and the technologist are the only ones present during the mammogram. The procedure takes about 20 minutes. The actual breast compression only lasts a few seconds. You may feel some discomfort when your breasts are compressed, but you should not feel pain. To help lessen discomfort, don't have a mammogram just before or during your menstrual period. If you experience pain during the mammogram, tell the technologist. All mammography facilities are now required to send results to you within 30 days. You will be contacted within 5 working days if there is a problem with the mammogram. Only 1 or 2 mammograms out of 1,000 lead to a diagnosis of cancer. Approximately 10% of women will require additional mammography. Don't be alarmed if this happens to you. Only 8 to 10% of those women will need a biopsy. A diagnosis of breast cancer is usually expressed as a number on a scale of 1 through 4, with stage 0 being a non-invasive breast cancer that remains within the original location and the higher number 4 being an invasive breast cancer that has spread or metastasized outside the breast to other parts of the body. The key to early detection is to find and diagnose breast cancer in a low number stage when it can be treated successfully and the survival rate is 98%. Let's recap. Every woman is at risk and early detection is the key. The steps to a good breast health plan are 1. Breast self-awareness of any appearance or changes, 2. Clinical breast exam, and 3. The annual mammogram. If it is time for your annual mammogram and you cannot afford to get one, call the YWCA of Greater Atlanta Encore Plus office to schedule for a free mammogram. Eligibility requirements are any woman 40 to 64 years of age, live in a metropolitan county, have no health insurance, and meet a particular income. If you live outside of metropolitan Atlanta, also call our office to find a location in your area for a screening mammogram.